of the women that I see over many years, and a real privilege to be able to observe these women, and even on Skype, when I do Skype sessions with women, I see that most of the women have been taught to use the terminology is the Cross Cradle Technique. So the Cross Cradle Technique, if you don't mind me demonstrating with my own breast, is for the mother to be taught, so if she's using the left breast, she would put her hand on her left breast and she would place her thumb here and direct the nipple upwards. The baby would be held by the base of the head with these two fingers. The rest of the hand would travel along the baby's neck, and the heel of the hand here would rest at about the 7th vertebrae. So when we do that with the little baby, and we've got the newborn baby or the young baby held by here, the baby can't move, it's restricted. So when it's restricted, it's trying hard to release from that restriction. It needs to be able to turn, rotate, bob, seek, find, smell, taste and touch. So with this on the 7th cervical vertebrae, in my observation, set off the Moro reflex. So you could only see one hand rise because the other hand's underneath. But the baby was almost trying to say, please don't do that to me. So with this happening, and the nipple to the nose, directed to the baby's nose, and then the mother taught to watch carefully for when the baby's mouth opens wide like the Kellogg's K, then the mother was constantly trying to work so that she timed it, that the baby's mouth was really wide before she pushed the baby onto the breast. And then she held the baby there so the baby still can't move, still restricted. It's very awkward for the mother because her upper body's twisted, and many of the women complained of wrist pain, shoulder pain and lower back pain during doing this over a long period of time. It was at that point, when I was seeing so many women taught to use this technique, that I began to realise that something was drastically wrong. So when I looked at what the primates did with their little babies, the big gorillas and the monkeys and that, they actually cradled their babies and held their babies here. So then I started looking at what the puppies and how they went to the breast by themselves. I put a lot of video clips up with all these little baby mammals feeding. And the puppies find their way to the breast all by themselves. They have a flat snout. They actually go to the breast and they're quite close connected to the mother's body. So that then rang a bell for me that, I don't think things are right. Okay, so what was wrong was the question for me. And so then I went in to look at the underlying anatomy, and I built models with a program called Visible Body, which I absolutely loved using because I could put all the pieces together myself and develop what I needed. So developing the cranium, developing the cervical spine and developing the intraoral cavity was real fun, great fun. And then it all came to me about what we were doing when we were holding the baby like that. When we were tipping the nipple to the nose, the direction, and when the baby hyperextended, the nipple ended up in behind the corrugated area of the gum. It's really rough if you run your tongue along there, very rough area. The tongue then trying to compensate to be able to do something with what's in the oral cavity, and so it would actually grind the nipple into the roof of the mouth. And that's when I started to see, I wonder if that's nipple tip damage, because I was seeing damage on the nipples at different parts of the nipple and different extremes and variations of the trauma. So nipple tip, I divided the nipple into 3 parts, nipple body and nipple base, and then the areola, because I was seeing other damage on the areola that I needed to know what was happening. And what triggered that off for me on the areola was the shape of the silicone insert that goes in the flanges. It was the same shape around the areola. So then I looked at how women were breast pumping, but that's another story. So carrying on with nipple trauma and what I was seeing and how we changed it, I started to think, well, why don't we go and do what the primates do? Babies are not held like that way with the primates. So I asked the mothers would they like to change what they were doing if I came across this situation with nipple trauma, with engorgement, with mastitis, and with a baby being held in the cross cradle hold. And with the elbows resting by the side, the mother's hand would fall naturally on the back, Many women were holding the baby by the nappy like this. And when they held the baby by the nappy, it pushed the forearm forward. So again, the head was impeded coming to the breast. So with arms comfortably resting, mother in a comfortable sitting position, not leaning back at this stage, because if she's leaning back, she can't feed in a shopping centre or wherever she wants to sit in public to breastfeed. It's very difficult to sit back and do that. So just sitting comfortably, quietly breastfeeding the baby. The hand falls naturally on the back, on the baby's back, and the mother's, all their arms are different lengths, so that'll vary. It doesn't matter where it falls. The baby rests comfortably on the knee. The baby's turned in to face the breast gently. Everything's gentle with the baby. It's not rough, it's not pressured, it's not twisted, it's not distorted. And the baby's then placed gently against the mother's body with lips over nipple. And if you watch carefully, the baby knows exactly what to do.